Good morning. We are excited to start this workshop, which is reaching so many people. Uh, I'll introduce myself first. My name is Maria Elena Peñaranda. I'm the Scientific Director of Sustainable Sciences Institute in California, in San Francisco, California, but we are a multinational nonprofit which helps researchers in the developing world writing a scientific proposal. The scientific proposal must communicate efficiently an innovative action plan using concise and specific language. That's kind of like a definition of how it should be. Communicate efficiently, well communicated, innovative. It has to have something new that you're going to research, and it has to be an action plan and a concise and a specific language. So we're gonna practice in the afternoons on how to write directly in science language, which is very direct and specific. But remember that the main objective of the proposal is to be financed. So we have to use tricks. We have to be conscious that there is a financial institution behind what we're writing. We are going to we're going to request them to please fund us. So they have to be convinced that what we're doing is going to be worth their money and worth their time. And the proposals that do not get approved or accepted are because they have inadequate concepts, not clear. No, it's not clear in understanding. It's not well written and clearly written in an orderly fashion, or it's a poor presentation, which is the same, is not well thought of. Poor comprehension of the selection process. That's what I was saying about the financial institution. We have to make sure what is that the institution is going to finance and adjust ourselves, our ideas to the mission that the institution wants to do research, wants the scientists to research on. And the lack of persistence, I put that in there because when we don't get the proposal right away, which is often when we are starting, and some people have more experience, but we should learn from this experience, take the critics that come with the revision and turn around and apply again. So persistence is one of the things, the motives that we don't get. Let's see. So you would report in a precise and concise language. Research has to be important, innovative, and pertinent. So important for our country, important for science. It has to have something new that we're gonna discover, but we're gonna fill a void that hasn't been studied. And it has to be pertinent in science, in the community, for our country, so it has to be something that is applicable or benefits the knowledge of science overall. And the research has to be feasible. So this is where we come in. We are going to work these 4 Thursdays on trying to do a proposal with the right methodology, with the right budget that match. So the chronogram and the budget and the methodology that you're proposing to do is going to have a budget. Let's say a small grant of $100,000 for 2 years. So it will be $50,000 a year. What can we do with that budget that is going to allow us to do the methodology that we want to do? Oops. And a personal history, good team, preliminary data, and logistics. What does this mean? Personal history. We have to have experience in the field. If we don't have experience personally, we have to have a good team that is going to back up our lack of experience in certain fields. If you have preliminary data, it's even better. You have to have the logistics. So in summary, the financing agent wants to see that you have the right methodology and the right experience and the knowledge of what you're doing before they give you the funding. So as I'll say it again, if you don't have the experience in this particular topic that you chose, then surround yourself from a good team, collaborate with people that have more experience in the field. And the presentation has to be logic, coherent. How do you narrow down the team when we're thinking about it? Although most of you probably already have a thought. So you have laboratory research, previous experience in a topic you are being studying. So you decide to write a grant to further that knowledge. You discuss with your peers. My apologies, what's happening? What is important? You know, we don't work on a void. We have a team of workers that can give us ideas of what we should do. Or we work on a team that some people do part of the research, some people does other part. The tech research needs, and if you have preliminary data, it's even better. This is a little counterintuitive because you need the grant to have the data. But if the more you can demonstrate that you're already working on this field, that you have done something similar, that you are in a group, and that you produce this data, the better, because that guarantees the funders that you're going to be able to do what you propose to do. Recent publications, new ideas, hypotheses, working with a good team. This is a big criticism from the editors of proposals, that you have spent maybe 6 months writing a proposal and you have your new ideas, but somebody else has done it. So you have to do a search of the recent publications so that you have all the latest work that has been done in this field, this particular field you're choosing, so that you are up to date. Because if they find work, if they find when you're reviewing your proposal, they already something very similar had been done and you haven't cited, that's points they take off from you because you're not up to the latest. Project grants and calls of priority and financing edges. It's important, this point I was making of project grants and calls of priorities. Sometimes they decided to study a specific disease. They are funding for or development of some methodology. Sometimes the financial have a call for research for the community, have calls for different diseases, malaria, well, I imagine COVID. So we have to read what it is that the financing agencies are funding when we're going to apply to this particular call for grants, and try to adapt our idea to their regulations. So it's not impossible. You know, sometimes we have an idea that we're going to study this particular disease like malaria, but this research calls for bettering the life of communities. So we can use malaria to better the life of these communities. So we could adapt our ideas to the priorities of these financial agencies and still be a worth candidate for the grants. So, but don't be too ambitious. You must be realistic about being able to complete a project within the grant time frame and having the right contacts or established collaborations. So it must interest you very much because you're going to be working with this topic for a long time. So don't, and it will show through when you write it. You have to be something that you know or you want to learn and you're interested. Be realistic and with the objectives, what, as we were saying, what is it that you can do? Realistically, have clear methodology and well-defined product. Very important. Methodology is one of the biggest sections in a proposal. So you have to be clear with the methodology so that the reviewers can be convinced that you know what you're doing, that you have all the methodology necessary to achieve these goals. Again, your academic background is important. Surround yourself for collaborators and teams, and possess objective indicators. Indicators is what is it that you're gonna obtain? What is the product that is going to benefit science after we have done this proposed project? And so you have to list why it is important, but also what will be the indicators that will come out of this project. What are the important products that we will have? So to define the project, for example, you can have a hypothesis. Cases of co-infection of dengue and COVID-2 have a high risk of mortality. There is one of the students that's going to be doing this kind of work. Or if you have a method, implement an immunoforensics-based strategy to design drugs against leishmaniasis. So they're going to try this new technique. So it's a method. Or descriptive, like suicide risk factors include adverse childhood events and lack of family to support. So there is some people studying suicide risks in adolescents. So it will be describing what happens to these patients. So write a preliminary draft. This doesn't have to be perfect because you're starting is the hardest part. So just write your ideas down, get something on paper. So begin to identify your key references. So, you just start write an outline of what is it, the idea you have, what reference there are, what could be the question that you want to answer. Sometimes it's obvious, we know what we want to do, and sometimes it's not so obvious. So write something and show it to somebody and see how it goes. If it's something relevant, is it something feasible? Is it something important? Is going to be something new to come out of it? That's new knowledge. That's what's the most important. So you do a little align. What is your question? What objectives you will want to ask? Which variables will respond to those objectives? Which methodology you will want to add? And then how you're going to analyze that methodology. So we're going to be talking about all this in more depth later. And you're going to be writing the group in the afternoon, your objectives and the problems that you want to study. So this is in generally how we go. And we have to have an idea of what is going to be our question, what is going to be an objective, our question or our hypothesis, how we can answer the hypothesis with a general objective and specifics, which variables are we going to study for each object, and which methodology is going to show us the results that we're going to analyze later. So this is the parts of the general proposal. It's going to have a title. It's going to have an exciting title if you can, because it's the first thing they read. So don't make a boring title of, oh, this describe the effects on patients and the several drugs tried, and it's a very general title that is describing the drugs, several drugs, and you don't explain exactly what your drugs you're trying, let's say for malaria, COVID, dengue. The abstract is going to be from 500 to 300 words, and the abstract and the title are the last things we write, because that we already have summarized our proposal and we have all the ideas clear. So the abstract will have like the statement of the problem. It's going to have our general objective. It's going to have the methodology we're going to use, and it's going to have the impact. So this is how we come to impact and justification. So the introduction, you justify why. Why is it we're doing this? It's part of the literature review in which we detect the void or the need to do this topic we're going to study. And the impact is what is expected from the results of this proposal. So impact is like when a meteorite, we're going to have a lecture on that later. Meteorite falls on the earth and the impact is the crater it leaves. So that's the results. What impact are going to have in the knowledge of science, in the community, in the hospital, in the patients, in the suicide prevention, possibly. So this is an important part of the proposal, but they want to see impact more than anything, and innovative, something new that is going to impact science. Methodology, if you are limited in the methods you're going to use, so explain the weakness, explain from the beginning, because the editors are going to find it. You have a timeline and a chronogram, again, that has to go with the budget. So a complete budget and a justification of each item has to go with the timeline. It has to go with the methodology, and the methodology has to answer the introduction. So it's all a chain. And for each item in the budget, you need to write a justification for each. Not all of them added, not all the grant agencies ask for a justification, but most of it. And then additional observations or addendums or annexum of, if you're going to be questionnaires and you have material, extra material to show, that's going to be. So the title and the abstract are the first sections read by the reviewers, make them attractive. The final title and the abstract are the last sections you should write, make them interesting and with new possible findings already in the title. Okay, so with this new method, we're going to find drugs to cure leishmaniasis. Is one of the projects that you're going to present. So already make it exciting, like you already did it, or what you do is going to be of good major consequence for the field. And begin with a working title. And we continue writing and rewriting the ideas and redefining our objectives, impact, and etc. And at the end, when we're writing the abstract, and when the abstract, or when they finish the proposal, and we have clear what our impact is going to be, what our project is going to be about, then we write a nice, exciting title. So title and abstract are the first thing the reviewers are going to read, and make it compelling so that they really want to read your proposal. And it's not a boring title like characterization of patients in a hospital with, with dengue and COVID. And then the characterization doesn't tell us what is that you expect to find. So it's better to say correlation between infections of these two viruses is a high risk of mortality, something I'm making up totally. But what could it be? Don't be shy when you write this title, because it's just to call the attention, and then they will read the whole proposal. This is the technical description. It's 10 pages, size 12. They give you exactly the guidelines. You have to follow the guidelines. Please, is there a reason to reject proposals if they don't have the amount of pages and the point of the word? It has to be a table of context, project novelty again, and contribution again, impact. Oops. It has, oh my God. I won't touch the computer. I want to touch the computer. So rationale and justification and references of what is that we're proposing, the proposed work. So rationale brings us to the proposed work. Expected results, again, we have to imagine we already did it. We have to imagine what great things we're going to see. Impact of result to the scientific and technical advance, impact for the country, impact for science, technical advance for the laboratory, the country, etc. Demonstrate project feasibility at the scientific, technical, and logistic levels. So again, you have to convince them that it's feasible with what you have, and you have the technology to answer those objectives. Objectives versus methodology has to match. Bibliography, the latest literature, as I said, and specific considerations. So that's what proposal is going to look like in general. And these are the parts we're going to cover. The evaluators are experts on the research area, not necessarily specialists in the exact topic or theme. So you are proposing. So please help them read, provide a logical sequence, use clear, efficient, and concise language. Convince them, articulate feasibility, relevance, and coherency. And respect the indication of the application form. Pay attention to the content lines. That is, it makes them mad when you don't. So again, I've been repeating myself in different ways. When I say here, help the, and the second point, help the reviewers provide a logical sequence, use clear and efficient and concise language. It's like you're telling a story to somebody, to a colleague or to your friend. This is what I want to do. I want to start this with this population, and I'm going to do this population, and I'm going to analyze the results this way. And once I finish, I'm going to have done these great things to this population, or these patients, or these suicide adolescents, factors for suicide. I'm going to, all these things sound very important, but you have to write them as a nice story in order with simple language. And the editor will thank you, and I will be in a positive mood when he's reading your proposal. So original contribution is going to be from the introduction. You're going to state at the end, after you did the literature review and you found what's important, you're going to have a general objective, you're going to have a frame of references, a problem hypothesis, and then specific objectives. So you're going to be slowly getting your mind into the specifics of the topic you want to research. So general objective is broad expected results of the whole proposal, the goal, the reference framework that you study. So you give theoretical background on the topic, and then in the background you introduce it, and then you say there's a problem in the literature in this field, because the background literature doesn't show there is a problem that needs to be identified. There is previous data that shows that could be different, or the data doesn't show. There is no data in this particular topic to answer these questions. What are the factors that bring a high rate of suicide in adolescents? Define the project hypothesis, so you will have an idea that a bad childhood, problems with the parents, lack of support, bad self-image are risk factor for suicide. But you have to come up with new data that is new, that you can show that this also happens in this particular community as well in this other community. So each one in your own field are going to be studying what is the problem shown in the literature and what new I can contribute to solve this problem. So general objective, broad intention, but realistic to the project or final result. The specific objectives must clearly describe the project step. Follow patients with leishmania in hospitalized patients with leishmania. There's a mistake here. So this doesn't tell us anything, right? It's like, okay, you have to specifically say what is going to be the clear result you're going to attain. So the broad intention is to find a cure, to find a novel drug to cure hospitalized patients with leishmania. So the general objective is going to have the result that you are going to intend to find, because we haven't found it, we have to do it, but this is our intent. So this is an example of how general it is. And the specific objectives, how bad it is to put a general objective. And the specific objectives will have quantifiable results on a specific time for the project. For example, review project with educators and members with the community to design a questionnaire. This could be specific objectives that we're going to start to follow introduction of modifications on or we're going to study a community or a group of patients. We first have to standardize. And one of the factors is to meet with the community to help to get their ideas to help design the right questionnaire. So it's just ideas. So we have the original contribution, introduction. First, the background, we start general. Suicide in adolescents rate is going higher. The studies show, so we go very broad, very briefly, not very extensive. This is more extensive. Here we show what the problems are, lack of knowledge, what is in the literature, what gives the frame, the background frame for this problem. So we're going to narrow the field here. And in the blue part, we're going to start saying, well, what is needed? It's, to study this population with these techniques, we have to determine which are the risk factors. And here in the green is how we're going to do it. So the introduction or the background in identification of the problem goes from why, that's what is an inverted pyramid. We start general, we review the literature, explain what are the voids, what are people have done, we're going to repeat it, people have not done, what is it going to be in our country, in our community. And then the blue, you explain specifically what we like to do or what is needed to do. And all of these things that you needed to do, you choose how you're going to do it. And that's the green point to the end. So the first paragraph is general and informs the reader why the subject that you're studying is important. So as I was saying, I just pick examples from your proposals. Adolescent suicide is on the rise worldwide as reported by reference, with high rates in developed countries reference. So when you're introducing the subject, the first words of the introduction or the background that they request, you have to have references. You have to start very general, but like tuberculosis causes 1 million deaths a year. You have to have a references of where is the information is going to come. Even though it's a general sentences we hear, oh yes, adolescent suicide is on the rise, but where is the data? Where is the specific numbers that is telling us this? The rates are going higher. Who reported this? How high, etc. But we don't stay there a lot. Then we just move into the factors. So don't make a very, very extensive introduction. Just introduce it, references, and move on to the specific topic that you want to focus on. So, so the background and problem identification, as I said, is an inverted pyramid. And here is where we're going to study the relationship with other studies. So the background of importance, summarize critical findings here, critical review of the results, approach contradictions on the findings that have been described. Do not forget your own work if you've done it. If you publish in the field, you reference yourself. I don't know, somebody told me that they've been told not to reference themselves. No, that's not good. You have to show the reviewers that you have worked in this topic, that you belong to a team that has published in this topic, even if it's not you, it's a colleague or the head of the department. You have to put your own work, because that is going to show the reviewers that you know what you're doing. So don't forget your own work. Include articles for the reviewers if you know, because I've had the experience when a scientist is reviewing my grant, and he says, you didn't include this work. And they get, but we don't know who the reviewers are going to be. But if we are up to date with the literature, we should be okay. And then there's other sources like annexes and questionnaires and other things. So you arrive at your problem in a logical way. That's the idea. I know it's not easy to do, but this is the guidelines in where you have to be brief, concise, and arrive to your problem at the end and explain it clearly. Then the specific objectives, it's going to be concrete measures, so qualitative, quantitative, to respond to the big question expressed on the hypothesis. Direct the activities of the proposed work. Guide the evaluation of fulfilled goals. So you propose what you're going to do. You are going to explain all the activities you're going to do. Remember, methodology is very long and detailed. And guide the evaluation to which are the goals that are going to fulfill in each. What are the answer of each objective? So you list the specific objectives at chronicle sequence if possible, or logical flow, depending on what you're going to prepare first in order to be able to do a second and so on. The justification is the problem relevance. Why research is important and why research must be done. Document the need of this topic. Indicate the statistical data that supports your case. Provide examples of what is the topic, what is the void, why your research is different to what is being done already. Very important, which is the innovation and sanitary, social, economical opportunity. Okay, so the innovation doesn't have to be just scientific. It could be sanitary, we're gonna improve, social well-being, ecology, conservation, opportunity for our scientists training of students, which is the innovation, and the international, regional, local opportunities. So the innovation, again, it could be international for the horizontal field. It could be only regional for a particular problem. It could be to our country. It could be a very local opportunity. So we try to find out what is going to new and how, what is new and how would that affect science at large. And offer hope to the reviewers, how your project will make a big difference. So you have to think about this at all times. Figures, and only if the use of figures and maps, only if it's necessary, especially maps if we're studying epidemiological study or we're studying conservation and a map shows specific things. Only if they contribute to the justification. For example, the incidence of a curve on the proposed work. The map is necessary, but it's not recommended. Only if there is a schematics that helps to explain the methodology, that helps, like a chart that helps how the methodology is going to be sometimes, or a new method that we're going to use, or new formulas. But don't use tables and figures from previous work that you have done to show. You just references. Few, one or two, to avoid larger paragraphs. Must be self-explicative and simple. If you include a table, a figure previously published, it's better to reference than reproduce it. Do not include tables and figures that you have published before. You reference yourself or you reference the team. It's not well seen, but it is well seen to show that you have done this. So include the fact that you did it and that you published it and reference it. Parallel activities to each objective only for the proposed objectives could be divided by chapters if we're going to do different aspects of a study. So you you say this team is going to study this part, this team is going to this other part. We're going to go in order. We're going to have different chapters. Depends on the type of proposal, but you can have a pilot, you can have a training grant if you train people, you can have an intervention and then a follow-up of the intervention, a validation of a technique, and the study specificity and sensitivity of a particular topic or disease. Include references and annexes. Involve a statistician on the proposal, development, and analysis phases. This is important to do before you send the proposal for review. You have to have a good analysis of your data that is going to have significance, statistical significance, or it's going to be the proper way of studying this topic, this population, these samples, all the work that you're going to do. You need to have a good methodology established from the beginning. If not, you probably won't be funded, and probably the results will be very hard to analyze and will make very good sense, or it will not be significant statistics if you didn't do it correctly at the beginning. And then at the time of publishing, you don't have data that you prove is being analyzed correctly. So yes, consult. We're gonna talk about methodology with Luceli and Maria Patricia, experts in the field, and they're gonna guide us through this process. So in the proposed work, we have definitions and background, area, population sample, epidemiological design, independent variables, dependent variables, intervention. You can include maps and figures. And then the specific activities for each objective that you're gonna have activities and experiments that you're gonna do. For each activity, why is your method the best? Only include the activities related to the proposed objectives. Sometimes people, I've seen that they describe all the other techniques that there are and why these are better. This can be mentioned in introduction if it's a methodology article, but proposal, but only include the activities that are really related to your objectives. Don't describe other methodology that you're gonna do. Give small details on the methodology, who and when, what controls are you gonna use, instruments to use, information to collect, analysis of the data. So be aware of all the details, what controls, what methodology, who and when, instrumentation, information to collect. Do I have enough? How are we do it with the time and money we have? And the analysis of data, how is that analysis gonna be done? So there are parallel activities for each objective, like I said, and they could be divided in chapters, depends on the type of proposal. These are training, an intervention, and follow-up. Many times we are not sure that we can do all the work, or we don't know how it's gonna go. We can propose for a pilot training, for a pilot work topic. This is valid because sometimes we don't have enough time, or we don't know the response. We're going to do a pilot, and then we're going to do an intervention and a follow-up. So you cannot, you can write a proposal to get started with the hope that you will continue later in a larger study. Include reference and annexes, and this is repeated information. So the proposed work from the general to the specific. So in the methodology, we're gonna say, we implement immunoinformatics-based strategy, which is one of the works that somebody's gonna do. Implement an immunoinformatics-based strategy. And the rest of the paragraph, this method consists of this and this and this, and was developed and is referenced. So you don't just say, we're gonna follow this method. We're gonna do PCR, we're gonna do this. No, you have to explain, we're gonna use this method that was described by so-and-so that consists and so on. So because the reviewer is going to want to not have to go to the references. If you do it very general, when you say, we use the following method referenced by so and you move on and say, then we're going to analyze the samples. The reviewer doesn't know what method you're referring to, and he has to go and look up the reference that you cited the methodology. So you explain the methodology on a small sentence. And explain what is that you're going to do in a small paragraph. So you can reference a previous paper related to the methods you will use, but be specific. What is not clear is the method already described will be used, but it will be better immunoinformatics-based strategy to design drugs, describe, and so on. So will be used. It will be used to find possible cures of leishmania doing these particular samples this way. So you describe better what you're going to do, and you briefly describe the protocol and the methodology and the expected results. Again, this is kind of hard to imagine, but you have to list what you expect, what is going to be the impact. List precisely the expected results at the end of the project for each activity and the global impact. Implementation of management strategies for pest and disease control. Diseases will increase the control of diseases, increases sustainability of coffee production by this one problem like that. So what you're going to implement, what management strategies for diseases that will increase or decrease, where you're going to organize them in the same sequence as the objectives and aims and activities. So it's nice to have an order in which you follow with the methodology as you listed in the objectives. Impact, baseline pre and what is expected post. Impact by country, region, and institution. Knowledge and abilities acquired, only that this is examples of impacts that you can list. So you acquire new abilities, you train people in new abilities, you brought new knowledge to this topic. Technology developed, you incorporated new technology that then could be used by the team and it could be trained others and used in general in the country. Human resources formation, students, technicians, PhD students, masters. Diffusion of publications. You are going to have to promise to publish because it's part of the research, scientific research, to please publish what you did. If not, we're not going to know all the trouble and work you did for all this time. And we're not going to learn about your new knowledge on this. And then your country and your team are going to be behind because they don't know, nobody knows, the scientific community doesn't know what you've done. So diffusion, publication, and transference, explain methods, teach others. That's the whole idea here that is going to continue giving you replication of what you did in other settings. Academic and experiment background in the subject of the candidate, the team, and the institution. It's important to have experience, to have a team, an institution that can harbor this, where the research is going to be done, that you have the support of a team that is experienced. Location, infrastructure, adequate equipment, logistics, and access to primary and secondary data. That's you have to determine the logistics, explain how it's going to be done, time and budget consistent with the objectives, infrastructure of the logistics, and institutional administrative capacity. This is important because when institutions are going to give you a grant, let's say NIH, they're going to ask for, if you have an institution that will be able to handle receiving of the funds. So you cannot work on a void, you need, sorry. So also explain your limitation and weakness of your technology of your studies, because you're not going to study the vast universe on this topic. So scientific limitations, technical limitations, logistics limitations. It's better if you say your limits before, so that the reviewer can know that you are being realistic about this and that there are technical difficulties always. So yeah, sorry. List them, for example, sequential activities. If one of the first fails, then what we will do. If uses a single device throughout the country, if it breaks, so we cannot just depend on the one thing. If extraordinary rains of the previous year was going to ruin our study. Social instability in the region, alternate region that we could choose. Periodic cost and inflation rate. So you have to correct for inflation when you do your budget. If a giant meteorite hits the world, well, nothing matters. So you can imagine, mainly, not so exaggerated, but mainly what could be done if you depend only one machine, where is an alternative use technology you can use. If you know there is social instability in the region, have alternative regions thought of. If the weather is with global warming is getting worse, so maybe you consider alternative regions. So mitigate the possible difficulties also by already imagining what the difficulties would be, and you can prevent to be ready for it. So the reviewers like that. Okay. Reference chronogram. According to the format of scientific publications, the references are only the relevant are written according to the scientific publication format. Only the relevant logical number, no more than 30, could be 40, but not a lot of references. Check with the text that is listed or missing. Make sure that if you reference something in the references, that you left the text when you edit, or the references are missing. So check before sending. If you have the correct references for the correct test, that you didn't delete parts and then left the reference in the list. The reviewers can be international, regional, or local, own references, and from possible reviewers, but mainly cite your own references. Possible reviewers, sometimes we know who is in the field. When I was in my laboratory in Houston, we knew who were probably reviewers, and then we'll try to keep their work in our literature search. The majority of time, you don't know. Chronogram. The chronogram is a timeline, the same order and numbering of the activities by stage and by a month. And later in the weeks, I'll show you examples of chronograms. If more than one institution is involved in the research, which is look positive. It's stimulated that you collaborate with other institutions. Clarify which part this institution is going to do. So if more than one institution is involved, clarify what is the role of each institution, which part of the grant each institution is going to be doing. Include the analysis, reporting, and monitoring, at least as often as requested by the agency. Show that you're familiar with the methodologies. So the chronogram does all this. If you're familiar with the methodology, then you know how long it will take to do the experiments you have to do. Additional information like cover letter, annexes, letters of recommendation. This would be example of annexes that you have to add. Letters of recommendation, letters for the collaborators, resume of the researchers, CVs, proposed function of each researcher, instruments used for surveys or protocol, ethical committee reviews. That is very important. All the countries now requested. Partnerships with other groups, they are encouraged. and codification manuals that you're going to use that are going the annexes. This is not going to be part exactly of the methodology. So all these things could be extra added at the end. How it's going to be, for example, sometimes they want to see the questionnaire you're going to use, which is very extent. So you cannot put it in the main text of the proposal. So what is that they are going to look for? The quality, if it's creative, original, and has potential for discovery. It's easy to say, but you have to be creative and think of something that is going to have a new potential and that has coherence, logic, rational, background of the group, literature support, and clarity. So this is what the reviewers are going to look for: relevance, oh, Dios mío, pertinence, and cost effectivity. This is what they want, that it is relevant to the field, that has pertinence, that the information is going to help others and it's going to be diffused and it's going to improve science, and cost effectively, so that the application of this is going to make them worthy to having given you the funds. How proposals are evaluated? Well, it's just some of the more scientific significance. Does the study address the important problem? How will scientific knowledge be advanced? Approach. Are the design and methodology well developed and appropriate? Are problem areas addressed? Innovation. Are there novel concepts or approaches that are going to be used? Investigator. Is the investigator appropriately trained? Environmental. Do the scientific environment contribute to the probability of success? Are there unique features of the scientific environment that this is evaluating? Overall evaluation scores reflects the impact on the field. And how to not be accepted: illegible, is not well written, not persuasive enough, untidy presentation, unclear, vague, you didn't make your point clearly, you use very general objectives or general data that is not specific. Lack of planning, budget problems. Lack of planning, budget problems will reflect if you don't have a good chronogram and you haven't planned everything and how much it's going to cost. Omission of supplemental materials, weak recommendations, and lack of compliance with the deadline. So number 10, it's a hard line. You don't submit by the date, you don't even consider. So make sure you submit 1 or 2 days before the deadline where all the proposals are being logged in, because that would be a shame that just for being 1 minute late at midnight, you didn't get in. Number 9, if you have weak recommendations, that surprises me, because you have to be recommended by your professors, previous people you have worked, people that know you scientifically. So you have to make sure that if you have problems or you're not clear with this person is going to give you a good recommendation, do not use this person. You have to kind of make sure that there's people that are have a positive image on your person and your science. So I just wanted to make that clear. So get feedback, present your work orally, formally, and informally. It reveals gaps, receive suggestions, and rewrite. So when we're doing a proposal, we know how we're doing, and we sometimes don't see the gaps. It's all logical for us. So it's better to present it to somebody, colleagues, to the team. It will be a more tighter proposal. It will be a better proposal if you have received already criticism from your community, your colleagues, and then rewrite and include the suggestions. Reread the guidelines, review the checklist one last time, send it with all the attachments. Try to really follow the guidelines. They will love you for that. Receive financing, so be aware of the reporting requirements. Most agencies do not send additional funds until your midterm report is received. So you have to put in the chronogram time for the midterm report. It will take you a month or so. You have to send some analysis of the data. You have to send what you're up to so far the first year, and then they will send you the funds for the second year. So you have to be ready for this. And many agencies now ask for interim reports before the final report. So if you did not receive funding, keep trying. Do not give up. You are in good company. It is not uncommon to be rejected. It is a learning process. It happened to all of us. It's encouraging, but you just modify the proposal as the recommendations received and send it again. Send it to a new agency, send it next year to the same agencies. The editors, the reviewers should tell you what it is that is wrong, what is lacking. If not, please ask for it, because that is, we're going to be very helpful, because it's usually 2 or 3 reviewers in the field that made these comments, and you want to know why, and you want to know how to prevent this, and you're going to include those modifications before you send the proposal again somewhere else or the several agencies. So you sometimes have to send several proposals for different occasions and different agencies, and you can adapt your proposal to the mission or call for research on that agency. Remember, you can even use their own language so that they know that you are in tune with their mission and that you adapted your proposal to that.
Good afternoon here in Colombia. And in my presentation, we will start going deeper in some aspects of the proposal. Maria Elena mentioned some general aspects, and I am certain that some of the questions that you had before will be solved as we move with this presentation during this workshop. There are some aspects that have to do with considerations, ethical matters, justifications, goals, methodology that I am certain will be answered as long as we evolve in this workshop. Now, we will focus on some techniques, some methods that can be used to identify the research problem, the research question, the targets, and the hypothesis. So to identify the problem, let's remember that this is the starting point, as Maria Elena just mentioned. This is the starting point, and we need to identify which the topic is based upon the need or the knowledge we have known. This is the first step. So which is the problem we will research? This can be a research challenge. This can be a daily practice challenge in our profession, in the lab, at the company where we work, in your clinical practice, at the hospital. It could be a need of something that we think should be developed, a new technique that we want to implement, or in the revision of literature, we realized that there are some gaps, some aspects that haven't been dealt with in such detailed manner. We can also identify a problem if there is an unmet standard or something that is expected but is not fulfilled. The World Health Organization always establishes goals. For instance, TB. The goal is the eradication of the disease, the decrease of dropouts in treatment. So which are the challenges that haven't been met, that maybe have been fulfilled in other regions, but not in our region? So these are still unmet goals, and this is identified as a research problem. Maria Elena also showed an example that are related to what the agency requests. If I want to request a financial award, I want to write my proposal according to their mission goals. So right now, many countries are researching SARS-CoV, and what are these agencies asking for as far as priority identification? So we identify a research problem, and we want to identify whether this problem is suitable or not for further detail. So this question will help us identify in further detail which is the research question and the problem that we will tackle. So for this purpose, we have to identify which are the factors that have an influence or relate to this problem. I will give you an example in a minute. So which are the factors associated or which are the causes of the problem? This is very useful to justify our problem and show how relevant this problem is. So when we analyze the problem, this is based upon all the knowledge that we have accumulated through our careers and should be supported by literature revision. Marilena said, if I said that the suicide rate has gone up, which is the reference to state that it has gone up, so it should be based on this literature review. Other than that, we need to identify local or national priorities. And this analysis should also be part of a team conversation. Talking over these topics with your team is very important when it comes to identifying and focusing the problem. When we want to analyze the problem, what we need to do is better understand a specific situation, which are the things that are relevant and how we could really identify this situation or this problem. When we need to analyze the problem and when we are writing down the problem, Marilena says that we have to go from the more general to the more specific. That is, what's the global situation of the problem, the regional situation, the local situation, and the situation in our city. In order to exemplify this, we have to talk about rates, health, if it's a health-related issue, prevalence rates, mortality, how often do we have this problem? What's the geographical distribution? So these facts will give us the possibility to show and showcase that our problem is essential and that this agency, financing agency, realizes that this problem is relevant for our research. So a full analysis of the problem is useful and necessary. So in this sense, we have this problem tree. Is the tree of problems, which is the logical framework. This tree of problems is used for intervention studies. It also gives us the possibility to deal with research problems. It is a methodology that is very successful. This methodology, called the tree of problems, identifies, as I was saying, which is the main problem, which is the key problem that I want to deal with, I want to focus on. The second thing we should identify is the lower part of this chart we see on screen. And so this problem we will tackle with, we have to identify which are the causes. This is number one, causes. What causes this problem? Which are the causes? This will help us define the problem, but will also help us identify the consequences or effects. So we can justify this problem if I identify and I can explore and explain all of these causes and I can see how this is related to the problem, I will give an answer to the consequences of this problem. Let me give you an example. Let's suppose that this is the problem I want to deal with. That is, we can all understand this problem. The problem is overweight and obesity in the general population. I believe that this is a problem in many regions globally. Overweight and obesity are more prevalent in developed and developing countries. So this is an increasing problem. Which could be the cause of the problem? Well, I have direct causes and indirect causes. This is a multifactorial cause problem. I'm not a specialist in this topic, but this is a list of causes that I thought of. For instance, one of the causes of overweight and obesity is a sedentary life. We are always sitting down. We don't have the need to move around. We have a lot of transportation modes, we walk less. So a sedentary life has given way to overweight and obesity. Eating habits. We eat industrialized food, we eat fast food, industrialized food with different compounds. So we have changed our eating habits. There is another issue which is a little controversial, that is the family history. Which is your family history? And of course, your baseline diseases. These are some aspects, not all, of course, but there are some baseline diseases that lead to obesity as metabolic diseases, hypothyroidism, and these are the causes. So if I look for information to support the fact that a sedentary life does increase overweight, that eating habits do have a relationship to this problem, I can really frame my problem and I can give my problem the appropriate importance and the need of an intervention. But I also have to elaborate on the consequences of overweight and obesity. Well, this is one of the causes of obesity and overweight that have this consequence. Which are the consequences? Hypertension, diabetes, less self-esteem, which ultimately leads to other mental disorders. And additionally, there is an increase in mortality rates. These are some of the consequences. So if I look for information about these consequences, I can justify the problem of my research, because if I can support and if I see which are the factors that have an influence on overweight and obesity in my population, I can propose interventions that can lower these effects and these consequences. This tree of problems in the logical framework methodology gives me the possibility to create a tree of objectives. I can identify the objectives of my problem. And the key problem is the general objective. And some causes we have in the tree can become the specific objectives or goals. So in this tree, we also have different types of objectives or goals. When we perform intervention studies or when we carry out community studies, we can use this directly. So this logical framework approach has given us the possibility to clarify the purpose and the justification of your project. If it's a development project, an intervention project, or a research project, you can identify all information needs to identify all the causes and the consequences. It clearly defines key elements in your project. Maria Elena mentioned the relevancy of the methodology, and the knowledge of the problem helps us analyze the environment of the project since the beginning, giving me the feasibility, how feasible is to develop this project. Makes communication among stakeholders easier, work teams, for instance, financing agencies, and helps us identify key variables to measure success or failure.
How can we identify, or what sources can we use to identify the problem? Many of you are from the health area and you are in clinical practice. Here we can have an important source to identify problems when we see how a health event behaves. For example, now with vaccinations, we've seen that younger people are the ones that are presenting the more severe conditions of SARS-CoV, at least in COVID, because these are the individuals that have not been vaccinated. So this event behavior can give us a research problem. And in this clinical practice, we can see the need to explore the factors that have an influence on a condition, or what are the effects of an intervention on an outcome. We can also have as a source to identify problems, literature review. Oftentimes, and that happens to me, I read about a specific theme and I say, we have not done this study in Colombia. So it's very good to have this available information locally to be able to complement it with international literature. So we can say this theme that has been studied abroad, how does it behave in our local context? And by revising the literature, we know the gaps in knowledge, what uh, aspects have not been studied deeply. Inter- Artificial intelligence has been used in many areas, and health has been gaining a lot of terrain. But many artificial intelligence tools in health has been used for certain pathologies, but not for others. So maybe we can say in these conditions, artificial intelligence techniques have not been used. We can apply them in these conditions to see what happens. So based on these sources of information to identify the causes, we can define the problem that we are going to study. And based on this, we will define the objectives. Remember, it's a sequence. Nothing is disconnected. We have the sequence, which is the research problem that we word to show its severity, how many people are infected, what communities are affected. We justify why that is important, and then we will set our research goals. These goals have to be tightly connected to our problem. And then we have the methodology, which will be strongly linked to the goals. So everything is connected. The goals of a project summarize what we want to achieve with this study. What are the goals, or what do we want to achieve with this study? These must be linked tightly with the problem, and the general goal of the study establishes what the researchers expect to achieve in general terms with this study, what is expected. I'm going to show you an example of this. So why should we set the goals of research? Because that allows us to focus on the study, on some points, and it guides us. It allows us to be focused, and it avoids us from collecting information that's not necessary. So when we have clear goals, we will know, we will know what data we have to collect to be able to understand and solve the problem. It also allows us to organize the study in parts or phases. Marlena just said that some studies that each goal uses a different methodology or technique. So if we have clear goals, we can have this approach, avoid collecting unnecessary data, and also organize the study in different phases. So how should the goals be set? They should be set in a way that they will cover different aspects of the problems and the factors that contribute to the problem in a consistent and logic sequence. The specific goal should allow us to achieve the general goal, but in a precise sequence. They should be worded clearly with actionable terms, specifying what will be done. The goals should be measurable and achievable. In the goals should consider the local conditions in a realistic manner. If I want to apply molecular techniques, but in the city where I am, it doesn't have them, and I don't have resources to have access to those testings, I should not have a goal that requires molecular testing. So we have to have goals that are achievable with the resources in the place and the time where I carry out the study. And we should use transitive verbs that should be specific enough to allow assessment. So I have to word or set a goal, and I have to see if it was achieved or not. So let's see some examples of transitive verbs that we use in research, like determine, compare, verify, calculate, describe, and establish. So what should we avoid? We should avoid intransitive verbs that do not express an action that can be uh, assessed, like, for example, appreciate or understand or study. These are examples of verbs that we should avoid because they're not very measurable. We also have to bear in mind that when I am assessing a project, the goals will always have to be compared to the results. If the goals are not worded clearly, you will not be able to do this assessment. And then when we express the methodology, one very useful way is to see for each goal what methodology can be used and what is the required information. So the goals play a very important role and they are should be consistent with the methodology. Let's see this example. This is a problem situation taken from a study carried out by HIV that is about 10 indicators for the response of the health sector for AIDS. In this problem situation, they see that the national program of HIV began a project to give antiviral therapy to 1,000 individuals with AIDS. They would receive counseling and documents with information on when and how to take these pills, and also the negative effects to health were, so they had to follow the instructions exactly. So to respond to this, we had CD4 and viral viral load monitoring, and visits were made to the homes. And it was seen that 43% of the individuals were not compliant, and they saw increased viral burden and reduced CD4 levels. That showed that the intervention was not being effective. So what were the discrepancies that were found? They found that the laboratory equipments were working well, so that was not a problem. The laboratory technicians were well trained, so it was not a problem of CD4 or viral burden testing. The people giving orientation or counseling were well trained and they were being supervised, and the instruction given to the patients were not complex. So if these were not the factors that were causing the low patient adherence, what was the problem? So we can have this in this research question. Considering that there are things that are working, that have an influence on this patient compliance, what other things could have an influence? So the question was, what factor or factors are responsible for the high rate of non-compliance to the therapeutic regimen in patients that have received counseling and monitoring? What were the possible answers according to the researchers? One is that the counselors are not trained to explain this in simple terms, the therapeutical regimen and the consequences of non-adherence. And other, the information is too complex to understand for people from with low education levels or who do not know how to read. The monthly visits to the family have made neighbors knowledgeable that they are sick, and this has created a stigma and discrimination against these families. And also, we have the presence of a severe adverse effects. This difficult compliance to treatment and the early effect of the treatment makes patients abandon the treatment early on. The hypothesis that can be formulated based on these possible answers of these possible factors is that considering that there are 5 possible factors that can have an influence on low adherence, research could be targeted at assessing these factors. And one of the hypotheses is that the low educational level of the patients is associated with the low levels of therapy compliance or patient compliance to the therapy. So this can be the hypothesis that drives the research, focus more on the educational level of people. So for this, we have a hypothesis. And here we should identify what is the factor that we consider uh, the exposure factor, which in this case is the educational level. It can be the cause or the influence on low adherence. And this adherence would be the dependent variable or outcome variable. Not all research projects have hypotheses. Some projects are conducted to generate hypotheses. They are descriptive. Not all uh, research projects have hypotheses. And when we do have one, it's important to uh, describe it clearly. And in this hypothesis, we should clearly define what is the cause and what is the consequence. So for this study, the objective was to assess the factors that determine the low compliance of the patients to the therapeutic uh, regimen in patients that received counseling and monitoring near the city X between July 2018 and July 2019. Here we want to assess, here we define the where, the city, what country, and the time lapse. During what time frame we are going to assess this effect. This is important because it's not the same thing to assess therapy or antiretroviral therapy adherence in Colombia than to assess it in the United States or Europe or in Africa. It's not the same thing across different continents and countries because we have different cultural conditions. So we have to clearly state the geographical limitation of the study and also the time frame. So here we set three specific goals that include determine. This is the verb that we're going to use for these goals. So to be able to assess what are the factors that determine low patient compliance, the first thing is what is the number and proportion of patients with low treatment adherence? We have to estimate the low adherence. So the goal is to determine the number and proportion of patients with low treatment adherence to the treatment. Well, that only tells me how many patients were compliant to the treatment. So if we want to be consistent, we have to determine the association between the educational level and the adherence to treatment. Remember that here we are in the hypothesis, determine the association between the educational level and the level of adherence to the treatment. And the last goal would be to determine the association between serious adverse events and adherence to treatment. So we have to see what is the association between these two. So these are the goals that will allow me to answer or to uh, achieve my general goal and see if the patients who comply to the treatment have low educational levels or are the ones that have a lot of adverse events in the response to the treatment. So the first thing that we have to do to be able to approach the research problem is to clearly state our research problem. So I have to list the causes that we will approach in our research problem. Then we have the causes, we're going to identify the consequences. This tree of the problem will be very useful to be able to define very well the problem, to highlight it and see how severe it is. And it will also allow us to have elements to justify the, the project, why this research is important. And then once this problem is defined, we will be able to set our research goals and our hypothesis, if we have one. We can have goals, as Marilena said. We can have descriptive research goal. For example, I want to describe the characteristics of the people with pneumonia. That is a totally descriptive goal. We can also have methodological goals where I want to assess a laboratory technique. We can also have relational objectives like this one, where I don't only want to see measure the low adherence to treatment, but also determine that the factors that are associated to low adherence to the treatment. So one of the activities that you will conduct in writing your projects should be to build the tree of problems. This tree has to be clear to be able to list the causes. Not all, we cannot always study all the causes, but we can choose which ones we can research. For example, for the case that I just showed you of increased overweight and obesity, depending on the source, we could try to see some uh, causes. If I have a clinical history, I have to use that information. I can have information related to comorbidities or related to family history or sedentarism, but we can also have information related to the eating habits. But if my source of information is the individual, I can interview this individual to see if they are overweight or are obese or not, and to see what factors I can ask the person what their eating habits are, what are their levels of physical activity, and their clinical history. So here we invite you to define the problem, list all the possible causes, and target. Uh, we can cluster them: family factors, social factors, and clinical conditions, and do a list of the clinical conditions. So we can cluster these causes, and based on that, uh, choose what we can research to have a more feasible project, and have our feet on the ground about what we can achieve or not. Well, of course, you would like to have unlimited access to or access to unlimited resources and time, but that's not the case. So we have to clearly set our limitations, considering the time we have and the available resources. So what can we commit to? And that should be in the goals. The goals are the commitment that we make with our research project, because this is how we are going to measure if we achieve the goals or not. This was the part of the problem. So this new presentation, this talk, is about looking for bibliographic references, and it's about reference manager that allows us to complement what we saw. We saw our problem, we listed the causes and the consequences, and then what information will support this? What will support that we can see what factors increase obesity and overweight? What can support the conclusion that the eating habits increase obesity and overweight? So what really supports this is a good reference search. We need this search to be able to support our research and so we need bibliographic references. We have to do database searches, and we have to use reference managers that we can see here. So reviewing the literature is very important because it allows us to understand the context and extension of the problem, how severe it is. Is it how I imagine it, or have other researchers found it to be a problem? Has previous research work has been done? So how significant and extensive the problem is? This review of the literature also helps us to identify causes. Sometimes we have the problem in mind, but we don't understand the causes that have an influence on this. And reviewing the literature help us to identify new causes to better support the ones that we had already identified. So this allows us to document and identify the causes of the problem. Uh, Reviewing the literature should be done permanently, not only at the end or beginning of the research. Should be a continuous process. When we are doing a postgraduate study that takes 2 to 5 years or more, if you don't update, maybe when you're going to publish your article, your paper, you have somebody that published something new before you. So that's a subject that was very novel, that when I researched that, when I was writing my research proposal, there was not much in the literature, but when I finished, we already have 100 new articles on the subject. So we have to do a permanent review of the literature. This is a must do. So when we do this review, we have to consider different sources because we have different types of literature. The one that's publicly that we find in different databases or libraries. We also have the gray literature and the one that is not published. The gray literature or that information that is in the website is also very useful, especially for the local context. And that unpublished information, as it was mentioned, it is important to talk about we can do. There is a very major problem. If we don't publish, the world will not get to know us and they cannot use us as a reference. So all this unpublished information sometimes can be what has the progress that's been made, the reference, but we need references that can be verified, of course. So what is the published literature? It's the one that we find in databases, but has always been peer reviewed. These are the sources that we trust more, and reviewers also trusted. Sometimes they say, you use websites or Wikipedia or Google, and I don't trust the information that you're using as a reference. But if you use high impact reviews or uh, publications that are very well ranked, then the reviewers will have confidence. So published data or literature is the one that elicits the most trust. So what can we use? Depending on the area, we can use the PubMed library, which is the largest one that we have access here in the United States, and it's one of the most trusted in the healthcare area. We also have Google Scholar, which is a very good source that brings together information of different libraries. In Latin America, we have Cielo that allows us to have access to some sources, additional sources. We also have Science Direct that allows us in many areas to find different publications. Scopus is another source that does not allow us to download the articles oftentimes, but it does allow us to do to revise the subject. So when I'm beginning with a new subject, Scopus has been very useful to know. So how many articles have been published about this subject? What are the trends? So it's very useful. So I insist that depends on your area. You must have some sources of your own where you do more searches. And in these searches, especially in science and in PubMed, we will have access depending on the licenses of the institutions where we work at. Sometimes we have articles that are not free access, and it depends with the review where they are published. Some are free access, and others you have to pay for the access. So for those that you pay, you can have access if we are working in an institution that pays for the subscription. So what's the gray literature? This is information that was produced in different government levels, different scholar levels, but it's a difficulty because they don't are not very credible because they are not peer reviewed, like technical reports or reports of different ministries or published by the WHO. These are reports that are revised by technicians, but technicians of the same institutions. While what is published in scientific reviews has been reviewed by peers and by uh, independent reviewers, and this gives more credibility to the data. But the gray literature is very useful to have an idea of the local setting. If we want to really delimit a healthcare problem, we have to go to the WHO and to the Ministry of Health of our countries, because in scientific articles or papers, we will find information related to research processes, but sometimes this information will not take into account our countries because, for example, the prevalence of the event, the incidence, and how the event behaves in different geographical zones. Of course, we can use gray literature. We can put it in the references as long as it can be verified. Here we have some websites where we can find different information, like the World Bank. I think they have information about almost all the countries. Each one of the countries has ministries of health, of planning, where we find different information. Almost have statistics and census institutes, and here we can have information about populational census data. And we also have the website of the World Health Organization, where we can find a lot of information that can be useful.
So, which are the steps that we suggest to start this type of search? First, define your search question very, very well, which is not necessarily your research question. Maybe for one single research question, I have several search questions. I might search every cause for the problem. So if I search the cause related to the problem, I will have several searches. So first, define your search question in literature. Two, which are the key words? So out of this research question, which are the key words that I will use in my search? Three, amongst these key words, which are the synonyms? Sometimes we use one word and the search is very restricted. Which are the synonyms that can be used or are recommended for this key word? Then I define my search strategy: overweight and obesity, obesity and sedentarism, or obesity and sedentarism. So if I use the word and, the search has to include both words. If I choose or, it will be either one. So keywords can be joined by and. Key words are joined by and or are used for synonyms. We can separate synonyms with or. And the word not is, for instance, for this case. I do not want to include clinical trials in my search. So I include the word not so that they do not include clinical trials or articles on case series. And the most important thing is to define your search language. Remember that most articles, literature, and scientific evidence is published in English. So generally speaking, our search should be in English. Many times in our mother tongue, and I say this because of Spanish, searches are very limited. I only find abstracts, but I don't find full articles. So we should bear in mind that the language in which we find most articles or most publications is English. So let me give you an example. This is one topic. This is a topic that some participants in the study are working with this topic. I apologize if I make a mistake here. So the research topic is neonatal sepsis in intensive care units. Which is the key word? Neonatal sepsis. That is my key word. But not in any case, neonatal sepsis in intensive care units. So the first step is to clearly understand the research topic or the question. And second, define keywords. And three, in my case, I will write the key word in English and Spanish or in Portuguese and English, but we should always perform our search in English too. And additionally, when we are searching and we have a compound term with two words, we should put these two words between inverted commas. I should put inverted commas so that they don't separate the word neonatal from sepsis. The search engine searches neonatal sepsis and intensive care units. So first identify the word, then I identify the key words. Third step, these key words are written in English and Spanish, and I look for synonyms. Intensive care unit can be written as the acronym. In English, ICU, and I can find it in different places. Another example, neuropsychiatric disorders post COVID-19. So this is exactly the same, the key word in English and in Spanish. Let me show you now. Give me a second. And this is the screen that shows how we can do the search. In Google Academic, in the upper right-hand side, when you have these three dots, we have the advanced search. So you can choose the advanced search to identify the terms. When it says all words, we will search for all the words or exact phrase. I use inverted commas. For instance, neonatal sepsis. So everything related to neonatal sepsis. At least one of the words is when we decide to use or. I don't need all the words, just one is enough. And this search, advanced search, can restrict the search in the title of the article or in the full article. If we are starting our search, my recommendation is to search in the full article. But if I want to focus on a topic written by Miranda, I write the name of the author. If I want to search in a specific publication, articles published in, I say JAMA or whatever. And if I want to establish a deadline or a time frame, I put it down here. So this is the word in Spanish, obesity, sedentary life or sedentarism. I don't put and, I just put both words because if I do not put an and, as I have put it here by default, they will search articles with these words. So, and I enter and there are 58,700 results. These are the results and these are the articles on the topic. So this is a way in which we can search material for our searches in each language. And I recommend you search in English too. And this is how we do it. These are the different ways you can do your search. In science, you have to do the search in English. The mistake that we do, which is us non-English speaking natives, is that we want to find original articles. So I need to enter the words in English. So how do I do this? I look for the words of my example. So I will consider these words between inverted commas, remember, because if I don't put inverted commas, they won't put the two words together. And I have to define if there are any other restrictions. I do not put any separation word. I don't include and or anything. And I have to include dates if I want. Search. And they say nothing was identified with these words. So I take away the word post-COVID and I search again. So in science, there are 11 research finds. What about PubMed? There are other options. We have the advanced search builder. When we want to search a word in PubMed, we can select whether they are medical mesh terms or descriptive terms. There are some words that are not health descriptive terms. If it is a term, if it is a mesh term, we have three options. It is mesh major topic, COVID-19, for my mesh major topic. It is the major topic that I will search. And I also want to say that I want to search neuropsychiatric disorders. So there we go, search, and with this filter, there are no results. Why? Because maybe the mesh term is not amongst the terms used in this library. So now I exclude the mesh filter. So like this, I perform a different search and I get different results. So what do? We change the search equation as we improve our criteria. So with these searches in the different search engines, we can use different filters. Google has a year filter. We can select a time period, a language, if we want to include quotes or patents. If we say yes, include quotes, we will see referenced articles, even though we might not have full access to the articles. And if we include patents, if we're working on a technological development, my recommendation is to include patents. Just give me a second and I will show you how it works. So we define our search with different search engines, academic Google, We also have PubMed. We also have different terms we can use, and Science Direct that I showed you. This is a broader search engine. It has no restrictions. Another recommendation is to write down your strategy. I have a chart and I write down the dates. If it was a manual search, which are the databases, and as I'm part of an educational institution, if I requested the article from the library, which were my search terms that I used, if I used the word and or the word or, if I used a filter, dates, language. PubMed gives me other possibilities to use filters on type of study, age groups. I write down how many articles I found, how many articles I read, how many I assessed, and how many I included. So if 1 month later or 1 year later, I redo the search, I compare. Oh, the first time I found 12, and the second time I found 20. So this gives me an idea. And when I manage my references, there are different literature reference managers that give us the possibility to store information, create libraries, organize information, and gives us the possibility to edit these bibliographic references to use them in our documents. In collaboration work, sharing references. These reference management tools can help us include quotes and references in a more simple way. Vancouver, AAA, which are the style that we will use, and we can adjust this to the style that the financing agency requests, or if we want to publish an article, to follow the directions of the magazine. The free of charge ones are Zotero, JabRef, and Mendeley. I use Zotero, not because it's better. These are the ones that are best known, very useful. They all fulfill the same function. So what do we have in Zotero? Zotero is similar to JabRef and Mendeley. We have a panel divided in 3 parts. In the left-hand side, we always have the collections. We have a list of the folders, how the information is organized. And then when we choose a folder, we have a list included as if it were the Windows Explorer, my file and my docs. And in the right-hand side, we have the information in each document. And this is really very important to consider because we can have articles and documents of an official page. For instance, the World Health Organization. And when I open it here, it doesn't even say the author, the year. So I have to complete the information so that when I include the reference, it's okay. So we have a correction list. We have the list of the documents I have in my collection of documents and my individual information for each document that can be changed and edited. So automatically, Zotero gives us the possibility to save references from different sources, catalogs, databases, web pages, files, scientific articles, papers. So this gives us the possibility to relate different types of documents. When we search, we can take from one list different options, or can even give us the possibility to individually identify which is the format of the article. This is the format of a PDF document, a book, a paper, a video. So these are the different formats that I have made. Maybe a publication in a journal or a paper, a newspaper. So these are the different resources. When we have a reference and when we search information in any search engine, this is the case with PubMed. This is the icon that could eventually appear. This is how you download the icon and you add it to the document. Let me show you how it works. So there we go. So this is the file, and we can choose from this file. I can select all, and I can include everything. I can download several documents simultaneously. And it also gives me the possibility to create different library collections. If you give me a second, I will open the program and show you how it works. So in order to download Zotero, the first thing we need to do is enter zotero.rg. So there we go. Zotero.org. Zotero.org. So it is a free of charge tool. So once you download the program, you download it and you install it. And I use Windows in my computer. This is my platform, but you can choose the one that you want in your personal computer. So you download the program and you need to install Chrome connector, which is the connector I need to use in my searches. So once I've done all of these steps, I have a lot of files. And once we install the program, the first time they will ask for our registration. What is a registration? Just to create an account as you have an account in Dropbox or with your mail, and you create your account. And by creating an account, you will have information available everywhere. So wherever you want, you can log in and you can synchronize your library with different computers. So this is the advantage you have if you create an account. So the first time that you use Zotero, look, synchronize, which is the account you will synchronize with, and it's my account. So what I was telling you is that we have all the information organized in different folders. These are the different articles. And then I have a document. You see what type of document it is. It is a conference article. What are the pages? It is an article in an academic publication. And I see which are the fields I will use for appropriate referencing. Let me choose an example here. 1 minute. So, for instance, this is a book. We have the author, the date, the URL. So this is a web page. So this is the web page, the title of the bulletin of the publication, where you can locate the web page, the year, and so on. So this is the 2018 TB report, who is the author, which is the ISBN of the book, etc. So I can change the information. I can, if I have any information, additional information, I can add it. So first you download the program. Once you download the program, we sign in, we register, create an account, and I create my folder. I create a new library. So I put OK, which is writing in this folder. And once I've done everything, I will download what I had found. Oh, great. The key words was overweight and sedentarism, obesity. This article could be interesting. I read the article. Yes, it could be interesting. I want to use it. The icons change depending on your Windows version, but I have this option with this icon over here for the extensions. It looks like a little hammer, and we have Zotero connector. I click over this and they say saving. It is called Golden Star. This is the document and it will be saved in my file. And I can choose another article, this one, sedentarism as a predictor factor. I read the article, I wonder if it's interesting or not. It is. So I go again, I click on this connector. You see, it's a different icon. It is not a PDF file. It's the icon of an article. So I save it in my folder. So if I have this information down here, it shows that the PDF has been saved. So I have two documents now, two documents related to the information. So sedentary life as a predictor factor. I see all the fields that I need. And obesity, mental health. I go over all the fields and then I can use my Word, whatever, any word processor, Windows. We generally use Word if you have Windows. So you open your Word and you start writing. This idea originated in a document that I read. So as I have Zotero installed in my computer, they give me this possibility, add reference. And the first question is, what is the format I will use? Vancouver, okay, which is the most widely used in health. And I select the article and I add whatever I want to add. There we go. And then the most useful thing with Zotero, which is I can also include references and the chapter of reference. But if I say no, I change my mind. I realize that I need to include a paragraph before this. So I include the reference because this information should be included after a previous paragraph and it automatically adjusts the references. Google and YouTube give you information on all the search engines, all the manuals and tutorials available. So if you don't have a manager, please look for a manager because they make your life super easy. It helps us organize our information. Searches should be done according to each cause that you identify. So you have thorough and updated information. If the topic of our search is a topic that is frequently researched, my recommendation is to establish a time limitation, 5 or 10 years. But if it is a topic that hardly ever has been researched, there are no time restrictions. It will depend on the literature available. So we have a problem identified that has different causes that will support the consequences that will justify this problem. And after doing everything, we need to identify references and documents that support everything we're saying. If we're saying there has been an increase in death rates of the young compared to elderly populations, I want to support my statement. Where did I get this information from? Which is my reference? And we need to consider other sources as the World Health Organization and universities. So that's it, Luisa. We can start with a Q&A.
Thank you so much, Lucely, for your presentation. So we are already short on time. We have 2 minutes left, but I think we should make some questions. I have selected a few. We had so many questions. Thank you. No problems. Thank you so much, all the participants, for being here with us today and for asking all these very interesting questions. It was difficult to choose some, but we'll send all of the questions to the speakers and they will select a few to reply in a written format, and then we will share them with you later on. So we have some questions in English and some questions in Spanish. So what we'll do is first I will start with the questions for Maria Elena, and then I will ask the ones in English, and Mercedes, the other REGI coordinator, will ask the ones in Spanish. So we'll start with the English ones, and then I will pass to Mercedes, and then she will carry on with the English questions, okay? Patrice Nagati has asked, should the research hypothesis be provided as well as the research questions or not? So in our proposal, should we already review what are our hypotheses, or should we just ask the research questions? So this is for Maria Elena.
Okay, so it doesn't have to have a hypothesis. You can have a research question, and that's fine. Many people do not have a hypothesis. You can directly have, you have to have a main goal, a main purpose, a main objective that's going to answer a question or is going to introduce a new methodology or something. If you already have your objectives, that's fine. What was the other question? Does it have to have both?
If you need to state what are your hypotheses in your proposal.
If you need to
say it clearly, for example, I think the level of this cytokine will raise, or do I have to say what I think is going to happen?
Yes. You can make up, you don't need to have a hypothesis. You can just go directly to the objectives. You can take the general objective, make it into hypothesis, but it's not necessary. It all depends on the guidelines of the agency. The agencies ask for the fact different ways, different things. Some agencies do not ask for hypotheses. Mainly all agencies want is a good objective, a good feasible general objective, and then at least 3 specific objectives in each proposal. That has to be clear.
Perfect, thank you. Now a question from El Faith Hazabo. So the question is, regarding the introduction, can we cite a review article as a reference, or should we cite the primary source of the information?
Cite the primary source of each information you place, please. It is very frustrating for editors and reviewers to go and see in this review article, and then they'll have to go and look at the review article and find your quote and then go back to the original. So no, review articles are for us to learn who's in the field, what's doing what, and if you want to quote, you quote that particular person that is mentioned in the review directly, not the review.
Thank you. So the other question is from Heba Mohammed. She's asking, what if someone publishes a study similar to my ongoing study? should I continue and compare the results?
Yes, many people are doing work simultaneously. If you consider your data would be adding some to the field, you have a slightly different focus, slightly different approach. So yes, continue with your work and cite them. Cite that this person is doing, has published. It's only published data you can cite. That this particular person has done something similar, and you will going to see if it agrees or disagrees with this research. That's part of the scientific research, to create data that either confirms or disagrees with previous data.
Perfect. Thank you so much. So I'll ask now Mercedes to please help us with the Spanish questions. So there is another one for Maria Elena and two for Lucely.
Sí, perfecto. La próxima pregunta.
Next question. The question from the Adelina Cubillas is, if I have to study that was already studied, but now in a region that we don't have data on the subject, for example, assess the complication of a procedure in other hospitals in remote areas, is that valid?
It was a question for me.
Sí.
Oh my God, por favor repita. Estaba pensando que las de español eran para Lucely, me enredé. Mi cerebro está un poco...
I thought that the question was not for me. Sorry. The question is, if it's valid to carry out a study that was already conducted, but in a region where we don't have data on that subject, for example, the rate of complications of a procedure in hospitals in remote regions. Yes, it's very valid because the results will be different.
Gracias.
Estoy hablando en español, ¿no?
I'm speaking in Spanish, ain't I? Yes, but you're in the English channel.
Aquí dice que estoy en el canal de español.
Here it says I'm in the Spanish channel.
Luisa, can you confirm the translation is going well?
Estoy en el canal de español, ¿no?
I'm in the English channel. Am I not? Can you hear me?
I can hear you in Spanish.
Okay. Is that okay? Okay. I don't know what happened, but as I was saying, doing the same study in another hospital is very important. It's very important to have data from different settings, of course, from a different hospital, for example, a different environment. Another English for Lucely from Norma Cartelin Delgado. In a research work validating instruments, if you don't have backgrounds of the instruments or they were poorly conducted, what do you put it as a background? Well, more the problem that we want to approach, what the validation is about, what do you want to research? You cannot do validation, for example, to measure quality of life. So you don't have an instrument to measure quality of life. So why is it important to approach that subject? And if the group has worked doing validations, so you can put references as those validations as background. And if nobody has worked on that, well, it's a new subject, but you can put different backgrounds. It can be validations of different subjects to enhance the importance of the subject. Frequently with validations, you have very novel subjects, so you can use that part perfectly. Perfect. Another question from Isabel Navarro Velasco. Is it recommendable in the goals, be it specific or general, to use two verbs like identify and characterize the species, or is it recommendable to only use one single verb in each goal? We recommend to use only one verb in each objective, because if we have two verbs, maybe you have two different actions, then it is likely that it was better to separate them or use a verb that can put together the two actions that you want to do. So the most recommendable thing is to use only one verb.